My name is Jordan Wilson, and I'm presenting on optometric vision therapy for speech 1311. Here is my outline, my verbal citations, and my references. Okay, I'll show you my audience really quick of 5 adults. And we'll get started. Okay, so I'm going to be presenting on optometric vision therapy today. If you visited the optometrist recently or even as a child, you might recall reading the letter chart, and they're testing for 20/20 acuity. That's always the goal. But vision is actually a lot more than just 20/20 acuity. It's your ability to see without effort and to see clearly. So today I'm going to walk you through the concepts of optometric vision therapy to treat visual dysfunctions in the binocular, accommodative, and ocular motor systems. I'm going to be discussing 3 main points: a brief definition of vision therapy and neuroplasticity. Then we'll go into the 3 areas of visual efficiency, and last I'm going to show you some therapeutic tools that we use to treat these areas. So first I'm going to introduce vision therapy and neuroplasticity. Vision therapy has been around since the 1920s, but it's still actually considered a relatively new field in optometry. The goal of vision therapy is not necessarily to strengthen eye muscles, but it's actually to retrain the brain and retrain the visual pathways through neuroplasticity. And Dr. Hung says it best when she says, contrary to age-old assumptions that changes in neural pathways are possible only during critical periods of development, modern neuroscience views the brain as a dynamic structure throughout life. And this neuroplasticity is what actually allows us to retrain those visual pathways to create more efficiency visual systems. So why is this important? Vision therapy actually helps patients to develop these fundamental vision skills that are needed for day-to-day living. So we're going to go into the 3 areas of visual efficiency. The first is binocular vision, or eye teaming, and it's our ability to keep a single image. And so patients that actually struggle with binocular vision may experience something like this, where they report double vision. If you can imagine, seeing this every day is going to make your day-to-day living a lot harder, whether that's through reading or seeing 2 cars on the road. So single vision is something that's extremely important for us. The next thing we're going to go over is accommodation. And so accommodation is our eye focusing. It's our ability to keep a clear image throughout a period of time. And so patients that struggle with accommodation might report a range of different abilities of focusing. Now, when they go get their vision tested, they'll still test as 20/20, but it might look, this is a lot different than looking like this. So their goal is to keep nice, clear vision over a sustained period of time. The last thing we're going to go over is the ocular motor system, which is eye tracking. It's our ability to jump our eyes from one point in space to the next, also known as a saccade. And one of the things that we're most concerned with is a saccadic movement from left to right. So I've brought this little visualization. This is a visograph that is used to show how a patient reads a story. And so if you notice this red line, it's actually tracking where their eyes are moving. And this patient has an ocular motor dysfunction where they have a really hard time making efficient movements from left to right. You notice that it often jumps back to a previous word, or it might skip a line. And so the patient takes a lot longer to read paragraphs or read stories, and they miss a lot of the information that they need because they're working so hard to move their eyes from one point in space to the next. So this is just a good example of what an ocular motor dysfunction might look like for patients. So a lot of the times people think that this might not affect them and that it's something that's not necessarily important. But according to Dr. Dominic Mano, clinical trials to determine the prevalence of binocular vision dysfunctions with the general population suggest the possibility of up to 56% or 60 million men, women, and young adults have symptoms associated with a binocular vision dysfunction. And 45 or 61% have accommodative problems. So this is something that affects a lot of our population. So last I'm going to show you an example of some therapeutic tools that we commonly use to treat these dysfunctions in the visual system. The first that we're going to go over on this far left side is a Brock string. And so this is used to work on that binocular vision. The goal of this activity is the patient is trying to look at the different beads at different distances and keep it single throughout the entire time. Next, to treat the accommodative system, we often use a lens flipper. The goal of this activity is the patient holds up the lens. There's a plus side on one and a minus side on the other. As the patient clears the plus side, the lens within their eyes actually have to relax as if they're looking far away. And their goal is to maintain clear single vision. When they flip over to the minus side, the eyes have to constrict as if they're looking really close and again trying to sustain clear single vision. Last, to treat the ocular motor dysfunctions, we often use something called a heart chart. And with this activity, we often have the patients patch, so we stimulate one eye at a time. They jump from reading the first line to the last, back and forth from left to right, top to bottom. We often integrate a metronome with this activity so that they're having to make nice equal jumps, or those saccades, from left to right, top to bottom, to help treat that. So I've given you a brief introduction into the world of vision therapy. We discussed the concepts of neuroplasticity and the brain's ability to change and adapt to new information. I informed you of the 3 areas of efficiency, so binocular vision, accommodation, and ocular motor. And last, I've shown you some of the tools that we use to strengthen those systems. Vision is more than 20/20 acuity. It packs a significant part of our daily lives. It's important to make sure that all three areas are functioning properly to ensure optimal visual efficiency. And Dr. Susan Berry said it best herself, who completed a vision therapy program. As we learn to coordinate our eyes, our vision becomes more efficient. The world becomes brighter, bigger, more texturized, and more detailed. With these new views came feelings of deep joy and childlike glee. Thank you very much.